May is Maternal Mental Health Month, a time to raise awareness of the importance of every woman's mental health during and after pregnancy. 1 in 5 women suffer from a maternal mental health condition. And Gift of Life licensed clinical provider Articia Hunter shares what that experience is like and how we can better support moms and their families.
The most common maternal mental health disorders are perinatal depression, perinatal anxiety, perinatal OCD, and postpartum post-traumatic stress disorder. Sometimes moms have a feeling of it's not joy. When the baby cries, it's like, oh gosh, here I have to do this again. And they feel bad because we as little girls, we had our baby dolls and we were taking care of our baby dolls. And when you have a real baby, my personal experience, when you have a real baby, it's not as easy. And it gets tiresome because your lack of sleep, you're probably healing from either a C-section or a really rough birth. You may not have the support that you need from your partner or your family or friends. And having that feeling of, it's guilt, it's mom guilt. It's like, I really want to do this, but I don't want to do this. But the baby needs me, so I have to get up and do it, And that is when I talk to my clients, I say, especially if they have depression, what got you out of the bed this morning? And all of them say, my baby. So in reality, even though the moms are experiencing postpartum or, depression, anxiety, or whatever it may be, their babies are what's keeping them driven. Their babies are what's getting them up every day. And then they have a person like myself or some of our other workers at Gift of Life who are supporting them and providing them with tools and information to help them. But if a mom is feeling really bad about the things that she's thinking, she may think negatively about the child didn't like me, I don't like the child. That's when she should reach out to someone for help, because it's not that the child doesn't love her. That's the only way they know how to communicate with us, by crying or, being fussy. That's the only way they know how to communicate with us in the beginning stages. The effects of these disorders during pregnancy will be a possibility of low birth rate for the child, premature birth, and sometimes poor health issues after birth. The effects for parenting would be the bonding between the mother and the child. And then long-term effects could be an issue with intellect, child development psychologically, socially, and emotionally. Some of the barriers to care for maternal mental health would be the lack of knowledge of the parent, the mother and the father, and then the stigma of mental health on the parent. They not wanting to share what they're feeling because they're afraid their child may be taken, or someone may have some negative things to say. And then that would cause a lack of support from family. Also, the lack of knowledge of healthcare providers, not being able to appropriately diagnose the moms with these illnesses after birth and even before birth, because perinatal is around 20 weeks gestation, all the way up to 4 weeks postpartum. Well, I feel that all the OBs should be aware of the mental health disorders that mothers can face during their pregnancy and postpartum. I feel like, in my opinion, if we were able to do the screenings with the OB while the mother was under the OB's care, that would speak volumes and that would be very helpful. And then even I was thinking about this, possibly the pediatrician, because the child goes to the pediatrician once a month. Maybe if the pediatrician would ask the mother a few questions regarding her feelings towards the child. Is she feeling overwhelmed or have any anxiety? I think that would be very helpful as well. and they could refer the mother to counseling or to programs like ours. Just knowing what's going on in the community would be beneficial for these healthcare professionals when working with mothers who are dealing with maternal mental health issues. There are a couple of different counseling agencies here in Montgomery that provide services for perinatal mood and anxiety disorders. And if for any reason someone gives us a call and they're wondering what they could do and I cannot assist them, I will be more than happy to refer them. They can reach me at Gift of Life Foundation. My personal work cell number is 334-313-0022, and my email address is ahunter@golfound.org.